Maldives is an island paradise, with more than 1,000 islands scattered across an azure blue ocean. A middle-income country since 2011, Maldives has achieved 5 out of 8 Millennium Development Goals and is on track for achieving the remaining 3. In WHO's Southeast Asia region, Maldives is renowned for its achievements in public health over the past few decades. It is a shining example of a country that is meeting its development milestones. Maldives committed to the goal of health for all, and with its community health workers pioneering public health initiatives in the island communities, Maldives has been able to control communicable and vaccine-preventable diseases. It has also seen a decline in maternal and infant mortality. But sustaining these historical achievements is not easy for the small island nation as it grapples with the impacts of globalization. It also has limited agricultural land. It has to import almost all of its goods and services, and it has a narrow economic base, dependent mainly on tourism and fishing.
We face huge challenges in delivering healthcare. Some of the challenges which we have are common actually to the rest of the countries in the region or elsewhere. One example is raising cost of healthcare delivery. Everywhere in the world, countries are struggling with finding ways and mechanisms to bring down the cost and make it health service delivery more efficient, more cost effective. So it's a challenge we also share.
As elsewhere in the world, Maldives is facing a changing disease epidemiology, with non-communicable diseases, or NCDs, causing 70% of all deaths. This is linked to lifestyle risk factors such as tobacco use, poor nutrition, obesity, and a lack of exercise.
What we had about 30, 35 or 40 years back was totally different. By then, the problem was all related to communicable diseases. But now the challenge is lifestyle-related diseases.
Over the past years, medical services with a focus on curative care have expanded rapidly. This has resulted in rising public health expenditure in areas such as infrastructure, workforce, pharmaceuticals, and supplies, most of which must be imported from abroad.
Some of the other challenges which we have perhaps maybe unique to the Maldives, or we face it more. One example is health professionals. We rely heavily on expatriates. About 80% of doctors who are working in the Maldives are foreigners, 60% of nurses are foreigners. There are some paramedical professions where 100% of the staff working here in the Maldives are expatriates. So these are challenges, and also we rely on import. All the items which we need to provide health services are imported. And the weak procurement and supply system here in the Maldives, especially the system within the public sector, raises the cost of these products several folds.
The very nature of this island nation, with its small population living on 200 islands scattered over 2 hemispheres in the Indian Ocean, constitutes a major challenge.
So there's got a lot of dispersed people all over the country, and with a small population of nearly 320,000. So per unit cost of healthcare in Maldives is much higher than any other large land-based countries.
To control costs and increase universal access to services, the Maldives government decided to reform the health sector by reviewing health financing, creating strategies for human resources, and centralizing procurement services. Following the World Health Report 2010, universal health coverage, or UHC, has been high on the international health agenda and on that of individual countries, with the aim of increasing financial protection and improving equity and the quality of services.
There should be a mechanism that there is enough health protection systems, public health measures, prevention and health promotion activities, so that we don't fall ill easily. And when we fall ill, we should be able to get back into health without expenses that we can't afford.
The success of public health in Maldives today depends on how well the UHC concept is understood by policymakers, those delivering health care, and those making use of health services, as well as on how the concept is operationalized. In 2008, the National Health Insurance Scheme Marana was introduced, covering about 25% of the country's population. 4 years later, in January 2012, the introduction of Asanda, the country's universal health insurance scheme, signified the largest change. Run as a public-private partnership, Asanda offers a comprehensive range of services, drugs, and diagnostics, subject to an annual cap.
We opened it up for all. The government provides initial health cover for every citizen. Health Insurance Act was enacted, taxation was introduced, and at the same time also in the health sector we also started doing the program budgeting, and also the national health accounting system was initiated, so that we know how the money we get is spent. We believe that the government alone take care of the healthcare services. So we encourage the public-private partnership.
Evidently, the patients appreciate the benefits of the Asanda scheme. However, while Asanda aims to provide a safety net, both government and household out-of-pocket expenditures are sharply increasing, leaving the poorer segment of the population at risk.
I think it's important that we try to keep up and maintain the model of health services where patients don't need to pay from their own pockets. It's very important. I think that element is missing at present, because we have a cap, we have a limit of 100,000 for 1 year, and that 100,000 is often exhausted in people who really need it most.
Asanda kita sungai ide, kamu ane lama hame furtama launch hodang warang undago. Hira shuga ane hospital launch halak befote. Then amila gotun launch hodage ane nuli begin coast guard hodang coast guard unga.
As the country gains more experience in universal health insurance, it is expected that Asanda will become more efficient and sustainable.
It is functioning to the extent that government puts in resources, it is functioning. It is not functioning with any degree of autonomy, with any degree of efficiency. So that is one area that needs to be reviewed and overhauled. And Asanda should be made a scheme that really meets the demands of the people, and a program that could be sustained. I believe we will be able to do it.
Reducing the cost of medicines would result in significant savings for the scheme. Medicines account for about 60% of the health expenditures of the poorest segments of Maldivian society, and about 29% of the wealthiest.
Essential drugs has to be supplied through them, because a health service without pharmaceutical is not complete. So currently today pharmaceuticals in the private sector, and that's why the supply of pharmaceutical is not adequate, because only profit-making drugs are being supplied.
In order to bring the costs of medical supplies down, the Government of Maldives is strengthening its procurement and supply capacity, centralizing procurement, and introducing generic medicines.
Moving to generic medicine is, I think, essential and crucial if you want to bring down the cost and ensure the quality of services, quality of pharmaceuticals.
But just maintaining a costly health workforce and infrastructure on each island doesn't necessarily mean the health services are actually being used. Medical facilities in the capital Male are observing a sharp increase in patient turnaround, and the tertiary level Indira Gandhi Memorial Hospital is also feeling the pressure.
People are very health conscious in a way, so when they get even a simple viral fever, they come to hospital seeking medical assistance for that. the whole country there is no referral system. The patient has got his own right to choose a specialist, and they have self-referrals. Many times when a specialist sits in the OPD, some of the patients they see, at times even up to 50% of the patients they see may not require that specialty referral at all.
The other reason is the universal health insurance in Maldives is a free service, whereby the people do not have to pay anything to get the health insurance. So I think there is also another reason for the pressure from the relatives to be referred to a higher center, though there is no specific reason which is required for the referral.
Irrespective of availability of services, I think there are a large number of patients still preferring to travel to Male, or even the locals in Male, a lot of them are traveling abroad for delivery. So it's partly a preferential choice, not necessarily because there is a medical need for the travel.
The expectation of our population, our people also has, they now see when they want to actually get medical treatment, they either go to India, Sri Lanka, Singapore, Bangkok. In our country, our people expect public system to provide that type of private health care, and meeting this challenge, the demand is quite a challenge actually.
This uneven use of services poses bigger policy questions about how the health system is organized, whether the workforce strategy is sustainable, and whether how people are paying for health care should be reviewed to ensure that health providers and patients behave in a more responsible and accountable manner.
I think we need to go back. We need to go back, giving an equal emphasis and equal importance to preventive medicine, to public health and to health promotion. And then public health itself is a huge area with very wide scope, and where the responsibilities lie often beyond the health sector. But I think health sector's role should be advocating and ensuring that those changes and are brought, those reforms are brought, and we have the necessary mechanisms and means for people to live healthy and live a better life.
The World Health Organization, or WHO, began its successful cooperation in Maldives in 1951, before the country's independence in 1965. The WHO Country Cooperation Strategy includes universal health coverage as a blueprint, with a focus on strengthening and redesigning its health systems. This complements WHO's traditional assistance in disease prevention and control, and highlights WHO's coordinating role.
WHO remains a trusted partner in Maldives' current efforts towards universal health coverage. The most important question to answer today is what works, and WHO is working together with the government to find answers to those questions by gathering and analyzing data and finding and providing policy options for the Maldives to choose its own path. Maldives has turned a new page in its history. Maldives faces new challenges, tremendous challenges, those challenges which cannot be overcome alone. With new needs and changing environment, WHO is also transforming as an organization. These transformations allow to offer new avenues of health diplomacy and diplomacy for the Maldives to interconnect with other actors regionally and globally.